Good evening, everybody. This is Dr. Kawthar Abdullah coming to you from Muscat, Oman. Tonight I'm going to talk to you how Asperger syndrome is different from classical autism. When you think of autism, you might picture a child who is nonverbal, has many stims, and has a lower IQ. But this isn't the case for kids with Asperger syndrome. There is no specific Asperger's test to tell the difference between Asperger's and classical autism, but many specialists agree that the two conditions each have different, unique behaviors. From the way that they communicate and the way that they learn, people with Asperger's and autism face unique challenges, but also have exceptional gifts. You should know that Asperger's is not an official, recognized, on its own, standalone diagnosis anymore. The American Psychiatric Association Diagnostic and Statistical Manual of Mental Disorders no longer considers Asperger syndrome a separate disorder. Now, since 2013, doctors, other health professionals, and psychologists have been instructed to diagnose Asperger's and autism both as autism spectrum disorder. Despite this new clarification, many specialists believe that children and adults with Asperger's have clear-cut symptoms that set them apart from those with classical autism. The lumping of autism spectrum disorder has caused quite a bit of debate in the medical community about the classification. Now, I'm going to go through the differences. The first difference is there is rarely a language delay. One of the biggest differences between classical autism and Asperger's is that kids with autism tend to start talking much later than those with Asperger's. The children with Asperger's don't typically experience language delay. They may have a slight delay, but they don't have a massive delay like the children with classical autism. While children with autism also, often seem aloof, those with Asperger's usually want to interact with other children and other people. Although they welcome conversations, kids with Asperger's do find it difficult to communicate and may come off as socially awkward to others. Difficulty in maintaining eye contact, reading facial expressions, and speaking without emotion are signature traits of Asperger's. Children and adults with Asperger's also find it difficult to recognize and express their own feelings. Now, the second one is the IQ may be higher than normal. While kids with autism typically have a below average IQ, those with Asperger syndrome may have a higher than normal intelligence. Some children with Asperger's have a very advanced vocabulary, may become experts in memorizing facts about specific subjects. For example, if they like sports, they might memorize specific sports statistics, or facts about dinosaurs if they like dinosaurs, or even different makes and models of cars if they like cars. Some kids with Asperger's are described as gifted and having intellectual talents. They may perform exceptionally well academically, but this may not always be the case. They may also have some behavioral problems that can hold them back. Now, the third one is the time of diagnosis. The average age for diagnosis with a child with typical autism would be between the ages of 18 months to 4 years old. Because kids with Asperger's typically don't exhibit language delays or have low IQs, they're often misdiagnosed or not diagnosed until much later, sometimes even up until high school or even into their adult years. Many parents might not even realize that their son or daughter has Asperger's until he or she starts interacting with peers or participates in social activities. Asperger's is often misdiagnosed as ADHD. Although these conditions are sometimes both present, Asperger's is different from ADHD in that it's a problem with socialization rather than a problem with focusing attention. The next difference is their brains are wired differently. Some research has shown that children with Asperger syndrome have different brain patterns than those with classical autism. One study in particular, scientists used the EEG to measure the amount of signaling that occurs between the brain areas of children with Asperger's and those with classical autism. What they found was kids with Asperger syndrome display different patterns of brain activity, which suggests differences in Asperger's may have stronger connections in the left hemisphere of the brain compared with children with classical autism. Other researchers have found that a region of the brain that controls language has more folds in it with children that have classical autism than kids with Asperger syndrome. While this research offers intriguing clues and great information on how the brains of people with autism and Asperger's may be different, more studies are needed in this area. Now, the next difference is children with Asperger's usually have less symptoms. Some specialists describe children and adults with Asperger's as having high-functioning autism. While this exact terminology is often debated, it is true that those with Asperger's generally experience less severe symptoms than those with classical autism. Because of this, people with Asperger's are often able to live independently, are able to attend mainstream schools. They can excel academically. On the other hand, many kids with autism will need specialized education, therapies, and support. Now, we went through how autism and Asperger's may be different. Now we want to go through how they are similar. While there are some differences between Asperger's and autism, the condition share a lot of the same symptoms. Children with both conditions could have difficulty in maintaining relationships, problems expressing their feelings or emotions, trouble maintaining proper eye contact, sensitivities to certain foods, textures, and sounds, issues with motor skills, a desire to follow strict schedules, an obsession with specific subjects. Both kids with autism and those with Asperger's may be perceived by others as awkward or strange in social situations. Additionally, they may engage in hand flapping. This is common in both disorders. We call this stimming. The bottom line is that both disorders require intervention. Sometimes there's no obvious difference between a child with Asperger's and one with autism. Signs and symptoms can be overlapping, and doctors may not make a distinction between the two disorders. Because of newer diagnostic criteria, and they lump the two conditions together, you may be told that your child has an autism spectrum disorder instead of saying your child has autism or Asperger's. So every child with autism spectrum disorder is different. He or she will experience it different. He or she may not have the same symptoms as other children or another child that maybe you know that has the condition. Your doctor can help you determine the specific traits that may further categorize your child, but for the most part, kids with Asperger syndrome and classical autism face similar challenges and benefit from similar treatments and approaches. The takeaway for parents is to tell your doctor if you notice the signs of Asperger's or autism. Both disorders benefit from early intervention. The sooner you can spot and treat autism spectrum disorder, the better chances your child has for a good outcome. Thank you for listening and have a great evening.